This is Emily Walker, MedPage Today, reporting from Capitol Hill, where on Wednesday, 3 separate congressional committees all held hearings on the same topic, healthcare fraud. After one of those hearings, I spoke with Louis Sacoccio, who's executive director of the National Healthcare Anti-Fraud Association, and he shared with me what the current state of healthcare fraud is and what physicians can do to combat fraud.
We spend $2.5 trillion in our economy, both on the private and public side, for healthcare. That's a lot of money, and there with the hundreds of thousands of potential providers out there, both for the private and public programs, there's just still great opportunity to commit fraud.
I asked Sacoccio what types of fraud physicians commit.
There would be two. They would be either upcoding, in other words, billing for a service, a more expensive service than was actually provided, or just billing for services that were not provided. I think those would be probably the two most common. The healthcare system is very complex. You have the CPT codes, which are billing codes, then you have the ICD-9, which are diagnostic codes that are now being expanded into the ICD-10, the new sets of codes. So it's a very complex system, and because of that, it's very important that both private and public payers keep up with those codes, what the changes are, and it's a challenge for providers as well, because obviously the vast majority of providers are honest, do the right thing. So, but the system is so complex that sometimes that complexity lends itself to exposure with respect to fraud.
If a physician suspects another healthcare provider of upcoding or another type of medical fraud, they should report it, Sacoccio said. The healthcare reform law contains a number of anti-fraud provisions, including a requirement that federal health agencies share claims data. That way, if a fraudster is trying to scam multiple agencies, it will be easier to spot. In addition, the Affordable Care Act gives the government the authority to suspend payments to providers during a fraud investigation. Sacoccio said he expects those provisions to eventually make it more difficult to commit healthcare fraud.
I think we're going to be making some inroads on that. I think, again, the move to better technology, the move to information sharing, you'll be much more successful, I think, in preventing a lot of fraud and certainly in catching some of it and going after it from a criminal standpoint. But I don't think you're going to see a decrease in the very short term, maybe in the longer term, as some of these things start to take effect.
From Capitol Hill, this is Emily Walker, MedPage Today.